Hello, my name is Rosalind, and I'm a nurse with Kettering Health. And today it's my pleasure to tell you about Healthy Arteries vascular screening that can help you identify your hidden risk of vascular disease. So I have a question for you. And my question is, if our arteries could talk to us, what would they tell us about our health? Often when we think of arteries, we think of our coronary arteries, and these are the arteries that feed the heart muscle. But we have arteries that go from our head all the way to our toes. So these are absolutely amazing vessels. These arteries carry the oxygen-rich and nutrient-rich blood to all of our tissues within our body. So when the health of the arteries is compromised, this can lead to very life-threatening complications that can affect our quality and our quantity of life. So before I talk about the screening, I want to just do a quick review about what arteries are, how they become damaged, and how that can lead to the process called atherosclerosis, which is that plaque building process within the arteries. And then we will go into how this screening can help detect that process early, before symptoms have started. So like I said, our arteries, they are amazing. The wall of our artery is actually made up of 3 different layers. And the function of the arterial wall is quite complex. It's got very important job to do within the body. Our artery walls help keep our blood flowing the way it is supposed to. Our artery walls help regulate our blood pressure. Our artery walls help so that we don't get blood clots. And our artery walls also help keep toxins out of the blood and provide the vessel for the nutrients to be taken throughout the body. And what occurs is when we get repeated injury to these inner walls of the artery, the body tries to heal that space, and that artery wall gets inflamed. And when the artery wall gets injured and gets inflamed, our body then tries to heal that. And inside the artery wall, what happens is the particles start to interact with each other. And over the years, plaque can start to build up. And plaque can build up to the point where you get narrowed blood flow, or that plaque can actually rupture through the artery wall, and then a blood clot can form. So when this blood clot forms, it stops or slows the blood flow to the organs on the other side. For example, our heart or our brain. So this injury process happening within our artery wall, it's hard for us to see. So I like to compare it to something that we can see on the outside of our body to help us understand what is going on. So I like to think of injury within the artery wall like a wound that I can see on the outside of my body. For example, if I take my arm here, and if I have a cut on my arm, my body works to help heal that cut. It gets red, it gets swollen. Basically, the immune system is working on that wound to help it heal. And this tissue will heal. But if I keep getting a wound in the same spot over and over and over again, yes, it actually may heal, but the consequence is that this tissue, when it's healed, may not work the same as it did before. So I like to think of the inside of the artery wall being injured repeatedly. And if it gets injured repeatedly, then long-term damage can occur. And in our arteries, that is the plaque buildup process. And when that plaque builds up, we know that increases the risk for heart attacks, strokes, aneurysms, and blood clots. So now I'd like to talk about what are the main risk factors that actually cause injury to that artery wall lining. And so these are the main ones. If we have high blood pressure, uncontrolled high blood pressure, if we have abnormal cholesterol, if we have prediabetes or diabetes, I like to add prediabetes in there because we know that the damage to our artery wall starts way before we've been diagnosed with diabetes. Metabolic syndrome, Smoking, that also causes a lot of damage to our arterial wall. Being physically inactive, obesity, carrying extra weight puts a lot of stress on our body. And then having a family history of early cardiovascular disease. All these factors working together injure our artery wall, putting us at higher risk for vascular disease. And I want to stress that when this is occurring, this occurs silently for many years. This is a progressive process, the plaque building process. It occurs for many years and silently. So we don't always know that it's occurring. And typically, when you find out that this has occurred, the disease may be in more advanced stages. And unfortunately, people can find out when, for example, they have their first heart attack or a stroke. So one thing we can do to help give ourselves the best chance to help prevent this are screenings. So early detection is key. And screenings that we offer, they're quick, they're non-invasive, they're cost-effective. And the healthy artery screening that looks at 3 different arteries within our body. So it's going to look for carotid artery disease. It's going to look at our abdominal aorta, looking for abdominal aortic aneurysm. And then in our peripheral artery, so looking for peripheral arterial disease. And I'm going to go into each one of these, explain what they are. And then we're going to have Dan, our sonographer, demonstrate how each of these is done on the screening. So the first test that the healthy artery screening does, it's detecting carotid artery disease. Our carotid arteries are the arteries in our neck, both sides, taking the blood off from the heart, taking the blood up to the brain. So if we have plaque buildup in these arteries, it decreases the blood flow and can lead to cognitive problems and then a higher risk for stroke. The healthy artery screening uses a carotid artery color flow ultrasound to screen for carotid artery disease. And joining us today in the studio is Dan Meibers. He's a sonographer that has done these screenings extensively for many years with Kettering Health. So first, the prep for this test is basically you're going to need to be able to get up onto the table, the exam table, and then lay flat. You will remain laying flat for the duration of the whole exam. And make sure that you wear clothes that Dan can easily get to the examination area at this point in the neck without being undressed. For this screening, you will not be in a patient gown. We want you to remain fully dressed. So once you are laid down, Dan will then, and the room will be darkened, Dan will place ultrasound gel on your neck, and then he will be using the ultrasound transducer and moving that up and down the neck. And he is essentially then looking at the blood flow in the carotid arteries, looking for any abnormalities. And after he is done with this test, then the gel will be wiped off and he can move on to the next test. And the next test that this screening looks at is looking for an abdominal aortic aneurysm. Well, let's just talk about the aorta first. So the aorta is a large vessel that comes off our heart. So if our heart is right here, the aorta comes off, loops around, comes off the top, sends blood through the carotids up to the brain. But the other part of the aorta comes down, loops around, and takes blood down to the lower part of our body. And this aorta is a very large vessel. And that plaque process can happen in this artery as well. And what happens here is when the wall of the artery becomes damaged, it becomes weaker. And remember, in your aorta, you have high flow blood flowing through there. So a lot of pressure is put on that artery wall. So if it becomes weak over the years, the wall can start to balloon out. And this is dangerous because if this wall ruptures, that is a life-threatening emergency. And once again, like plaque buildup process in other parts of the body, this process happens silently and is often hidden. Unfortunately, a lot of people find out that they have this is when that actually ruptures, and that is a life-threatening emergency. So this is where the screening can also help. A screening, once again, quick and easy, and it can detect if you have an aneurysm. So Dan is going to demonstrate how he conducts the exam for the aneurysm in the abdominal aorta. So for this, the patient will remain laying flat. The prep for this is, once again, you are going to wear your clothes. You're not going to change out of your clothes and get into a patient gown. So we want you to wear a two-piece outfit, meaning you are going to roll your shirt up to expose part of your belly. And the other prep is we do not want you to eat for 4 hours prior to the test. If you have food digesting within your body, gas can form up and that can hinder seeing the aorta properly. So for this test, Dan is doing the same thing. Once the area is exposed, he will apply the ultrasound gel, and then he will be moving the transducer over where the abdominal aorta is, and he's going to take a direct measurement of that aorta, looking for any enlargements. And then when he's done, that gel will be cleaned off. And the next test that the healthy artery screening looks at, it is looking for what's called peripheral arterial disease. So peripheral arteries, that is our arteries that are providing blood to our lower body, and they too can get plaque buildup, restricting the blood flow. When this happens, what people will notice is when they are being active, you'll notice pain, more unusual pain in your legs and your buttock area, that when you do rest, that pain will go away. This is called intermittent claudication. And the test that is used for this in this screening is called the ankle brachial index. And this uses a series of blood pressure cuffs and a Doppler ultrasound. So you will remain lying flat on the exam table. And the prep is really make sure that you have clothes that we can get to your bare arm and then your lower legs easily. People just raise up the lower portion of their pants. You will also be asked to remove your socks and your shoes. And here Dan will be demonstrating it. What he does is, starting up on your arm, he's going to put a blood pressure cuff on your arm. Then he's going to use the handheld Doppler, and he's going to put a little bit of ultrasound gel right where your brachial artery is. And he's going to inflate the cuff like you're getting your blood pressure taken. And then he's going to measure the systolic arterial pressure in your arm. And then he's going to move to your lower legs and do the same thing. He'll put a blood pressure cuff on your lower leg and then put gel on the top of your foot or behind your ankle. He will inflate the blood pressure cuff and then measure that arterial pressure in your lower legs. When he has both of these, then a ratio is calculated that can help see if you do have peripheral arterial disease. So in the beginning, I asked you, if your arteries could talk, what would they tell you? And I think they would tell you to prioritize and take care of yourself by addressing these risk factors that we talked about briefly that can lead to damage of the arterial wall. They would tell you to eat better, to move more, treat underlying conditions, stop smoking, stress less, and sleep better. So if you are interested in this healthy artery screening, they are recommended for people who are age 45 years and older with a family history of a first-degree relative of early vascular disease. And that usually is if a female relative had vascular disease that started before age 65, and if a male relative had vascular disease that started before the age 55. And if you have some other additional risk factors, like if you have high blood pressure, pre-diabetes, diabetes, if you smoke, if you have abnormal cholesterol, and then once again, that family history. So Kettering Health offers these throughout different locations in Southwest Ohio. If you are interested, for more information, you can call this number here and ask about the healthy artery screening. You will talk to someone that can help you identify if this screening is right for you. So I want to thank you for joining me today and learning more about this screening that you can do to help identify a hidden risk of vascular disease. My name is Rosalind. I'm a nurse with Kettering Health, and you can reach out to us for any further questions that you have about this screening. Thank you.